Distinguished guests, ladies and gentlemen, good afternoon. It is with great pleasure that I'm addressing the Medical Cannabis World Forum for the second consecutive time. This event today and your attendance means that we are fulfilling the promise we made last year to keep communicating, discussing new developments, and bring stakeholders together, to see that ideas and, more importantly, solutions are provided for the challenges and opportunities that lie ahead of us. Malta is a trendsetter, and it has to remain a trendsetter. And today, you will witness in greater detail how our Mediterranean island is working hard to keep the momentum and reap the benefits of the latest advancements. But being a trendsetter means that you need to lay down robust rules and regulations that allow for quality products and quality market. It means also that challenges need to be addressed through innovative solutions if we want to make sure that this industry has the opportunity to flourish. Ultimately, it is only a can-do, a will-do attitude that can make Malta attractive to new, innovative companies. And today we can use this opportunity, but we can say that we would like to pat ourselves on the back and just say how positive things are in Malta and the European Union, but I would rather focus on the challenges and make sure that we discuss how we can overcome such challenges together. In April 2018, Malta became the first member state of the European Union to provide a holistic regulatory framework for medical cannabis. The new legislative framework allows entities to cultivate, import, process, and produce cannabis intended for medical and research purposes under a controlled and supervised environment. Other EU member states have also started legislating this industry. However, I have to be very frank and honest with you. Until today, when I speak to different patients, it is pretty evident to me that getting access to medical cannabis is no easy feat. Maintaining the status quo will result in keeping some of the prices of medical cannabis on the high side and keeping patients unduly waiting for a treatment which they should be allowed access to. And I believe that things have to change. I'm a strong advocate for the patient's right to have access to different treatments, and medical cannabis is another treatment that can be provided. And it is frustrating to have patients who are clearly in pain, who need medical cannabis, who know that this treatment exists, but for some bureaucratic reason or other are denied access to it. They can't understand the situation, and to be frank with you, neither can I. And that's why I will once again today emphasize on education and advocacy. They are vital. If we want a new era that can really change patients' lives for the better, we need to invest in education and advocacy. Education for professionals prescribing medical cannabis is key. It can help them understand the research, the dosing, and also the endocannabinoid system, and can set the ball rolling. This is a new era of science, and if professionals were trained 10 or 20 years ago, they would have never been exposed to this system or to prescribing cannabis. That's why more research needs to be carried out, because things are changing fast. But even outlooks about medical cannabis need to be changed. This is not an alternative medicine. Medical cannabis should be considered a mainstream drug. After all, it has been used for a very, very long time. And yes, we definitely need to do more research, but that fact alone should not be used as an excuse to restrict the use of medical cannabis when there is already enough evidence that can show that this medication can help out certain cohort of patients. Which brings me to another point, which most of us here would consider logical. We are speaking about medical cannabis, not recreational cannabis. So why is it that many times medical cannabis seems to get treated with so much of a precautionary attitude that I'm given the impression that someone somewhere thinks that patients are using it capriciously? These challenges are not limited to Malta alone, but I believe that Malta should take the lead in addressing these concerns. And this can be addressed by setting up a medical cannabis education and research entity, which focuses on advocacy, education, and research. I consider these to be the three main pillars that can help change things. Investing in research and science will help engage professionals, eliminate hesitation, and instill trust both in medical professionals and patients alike. And it would be our opportunity to understand the benefits, but also the side effects or complications that may arise if it results that medical cannabis might not be the best drug for certain conditions. Patients who need medical cannabis require easy access to their medicine. Processes that create a lot of obstacles and hurdles will not help patients and will let the black market fester. And it's not what we want. Palliative care patients should have access to medicine when they need it most. Patients should receive a medicine in a timely manner. And we need to have an open discussion with regulators to make sure that this balance is achieved. However, governments still need to understand that medical cannabis can actually help them save money. In cases such as treatment-resistant epilepsy, for example, medical cannabis can help patients stay out of hospital and alleviate the suffering and help them live a healthier lifestyle. Less treatment in hospitals means less pressure on our public health systems. Which brings me to the next point: the importance of fine-tuning legislation and regulation to attract investments in this flourishing industry. Synergies are of the essence in the European Union, particularly in a scenario where the regulatory framework in the different EU member states is so diverse from one another. This renders the current European medical cannabis landscape complex, to say the least. It is challenging, and sometimes it is also contradictory. And I attribute this fragmented landscape to the lack of widespread scientific studies. And it is precisely for this reason that I insist so much on the need to invest much more in research. As things stand today, we are seeing companies from outside the EU having vast experience in this field, partnering with local entities when entering EU markets. Partnering with the right people in any country is key to add value to a foreign company and help it understand and adapt to the cultural and economic environment of a market. Choosing a geographical location is not dependent only on cost of production. Now, it is true that for a company to be sustainable, it has to be able to make profit. But companies also look for a regulatory environment that is conducive to the growth. They look for markets that can offer opportunities beyond their shores. And they look for places where doctor and patient education are given the priority they deserve. The prime ingredient for success is the right corporate attitude. Flexibility, both in production practices and product manufacturing, together with proper guidance on how to navigate throughout the European Union, is essential, particularly in an era where the EU framework is still being shaped. And the current uneven European landscape is not affecting only investors, but it has a direct impact on the patient's ability to access and use cannabis-based medicines and cannabis for medicinal purposes. And many times when you speak to patients, you realize that this is resulting in an ambiguous reality, where you have a patient in one country who can rely on a medicinal product, but if on a holiday or out on work in another EU country, he or she won't be allowed to use it. It's exactly like telling a person who suffers from diabetes, sorry, but you're not allowed to use an insulin pen here. It's unthinkable. But back to investors. Medical cannabis investors are not looking only for the right economic climate or the right political climate, they are looking also for the right natural climate. And I believe that Malta has the potential to be the perfect destination for cultivation, making it ideal for companies to set up shop on the island. Being the first mover in areas such as blockchain, artificial intelligence, and also emerging technologies, Malta has the potential to be Europe's island of innovation, the place where ideas are born, tried, and tested, then shared with the rest of the world. So it is therefore great news to hear, for example, that a number of companies are projecting to start exporting medical cannabis from Malta to Europe as early as next year. And we are here because we believe in this investment. But this investment is not just monetary. This investment is about people's lives. And this is what influences my work as member of the European Parliament in the Committee of the Environment, Public Health and Food Safety. The European Parliament this year approved a resolution on the use of cannabis for medicinal use. And this resolution calls for an EU-wide policy for medical cannabis and also properly funded research. However, while the World Health Organization has officially recommended that the cannabis compound cannabidiol, CBD, should not be classified as a controlled substance, we have the European Commission who stated that food supplements containing CBD were to be defined as novel foods, which means that many CBD products now have to be registered in a costly, time-consuming, and cumbersome process. It means also that CBD products can't be sold without additional safety research. Now, usually, the novel foods distinction is given to products if they have not been significantly consumed before 1997. So far, few member states have enforced the European Commission's novel foods policy after the regulation in January, and some associations are also challenging the EU's position. But it goes to show how much more we need to work to make things really happen. And I'm a firm believer in simplifying matters and not complicating access to medical products that can have therapeutic effects for patients. And I believe that as more countries will seek to tap into this growing market, we have to make sure that quality remains high. Effective legislation does not hinder quality and it does not hinder growth. And effective legislation ultimately is what will provide stability for investors and also peace of mind for patients. But to remain on this path, the European medical cannabis industry must keep an open dialogue with the healthcare professionals and patients being part of this holistic plan. Consumers must feel confident that there are the systems in place that support product traceability, accessible information, and also accurate labeling. And Malta is deeply carving its name in this innovative industry. I believe in facilitating things. So let's facilitate things. Let's make sure that Malta and the European Union remain the first mover in this innovative industry. But to make this move, to make change happen, we need to be engaged. We need to keep this line of communication open together with different stakeholders, including different authorities and also politicians and people involved in the regulatory aspect. I look forward to the coming days of discussion that I'm sure will be fruitful. I look forward to meeting you again in the coming months and next year for another summit like this, and I wish you all a fruitful discussion. Thanks a lot.